Hi, Dr. Don Hayes, DC here for the EndFlame program. I'm here today to talk about recent research from Harvard Medical School that's a game changer for the treatment of degenerative disc disease, the number one reason for patient visits to chiropractors and the most common cause of low back and neck pain. I'm going to discuss how the orthopedic surgeon that conducted the research at Harvard used the omega-6 to omega-3 ratio blood test, the very same test as our EndFlame test, along with omega-3 supplements to reduce degenerative disc disease and symptoms of spinal disc inflammation, dehydration, pain, and degeneration. Now, over the past year, you've heard me talk about the science and value of using the EndFlame at-home fingerstick blood test in your practice to measure and monitor musculoskeletal inflammation. Ever since Dr. Charles Sirhan at Harvard discovered a hormone-like molecule made by the immune system that's derived from omega-3, EPA, and DHA that he named resolvins, I knew the EndFlame blood test that measures for EPA and DHA deficiency would become a prominent tool in the treatment of neck and low back pain. Recently, a new study from Dr. Sirhan at Harvard revealed that resolvins serve as the body's natural stop signals to inflammation. Now think about that for a second. A molecule that's made by the body's immune system on demand at the time of injury from omega-3, EPA, and DHA, according to Harvard, acts as the body's natural stop signal to inflammation. Now this brings me to a newly published research paper from December 2019 by an orthopedic surgeon from Mass General Hospital at Harvard that's taking the medical world by storm and building on Sirhan's resolvin discovery. Dr. Zachary Napier, MD, hypothesized in a research publication that dietary supplementation with omega-3 fatty acids, both EPA and DHA, can reduce degenerative disc disease. By the way, degenerative disc disease just happens to be recognized as the most common cause of low back and neck pain in the world. Degenerative disc disease and related neck and back pains is the fourth leading cause of visits to medical physicians. As I said before, it's the number one cause of visits to chiropractors, costing the healthcare system more than $200 billion a year. Dr. Napier and his colleagues set out to investigate the effects that omega-3 fatty acids have on degenerative disc disease. When I learned of this research, I thought, wow, here it is, the scientific solution all chiropractors, and in fact, all practitioners that treat neck and low back pain have been waiting for. And guess what? Dr. Napier and his team used the omega-6 to omega-3 ratio blood test, the very same test as the EndFlame blood test, to find out if the omega-3s can reduce degenerative disc disease. Prior to this research, degenerative disc disease was one of the most misunderstood and incorrectly named conditions in medical science. Despite what the name suggests, degenerative disc disease is not a disease at all, but a condition in which natural age-related wear and tear on a disc causes pain, instability, and other symptoms. Dr. Napier's research now makes it obvious that the likely cause of degenerative disc disease is a dietary deficiency of omega-3, EPA, and DHA, causing a reduction of cell membrane fluidity that creates dehydration and stimulates an inflammatory climate inside the interrow disc. Since the number one treatment of choice for degenerative disc disease is over-the-counter drugs, Dr. Napier stated that omega-3 fatty acids might be more effective at resolving acute inflammation due to degenerative disc disease via resolvins than NSAIDs and COX-2 inhibitors, because omega-3s are known to produce resolvins while NSAIDs and COX-2s inhibit them. Finally, in the conclusion section, Dr. Napier stated that daily oral supplementation with omega-3, EPA, and DHA for 2 months decreased degenerative disc disease as demonstrated by the omega-6 to omega-3 ratio, MRI analysis, and histological slides. He went on to say this study suggests that omega-3, EPA, and DHA supplementation has potential protective effects on the progression of degenerative disc disease, and therefore it's important that omega-3 dosing be optimized in every case. Now, what this research means for the average chiropractor and in fact all healthcare providers that treat neck and back pain is there's new research and a new protocol on how to treat an old problem, degenerative disc disease. Now, what's the best way to integrate Dr. Napier's research into practice? By recommending the EndFlame omega-6 to omega-3 ratio blood test for all patients that have neck and back pain, and use therapeutic doses of omega-3s to support muscle and joint pain and improve treatment outcomes. Now, implementing the EndFlame program is easy. It has both subjective and objective components, and everything that's needed to conduct the test at home is included in the kit. Patients fill out the subjective EndFlame survey form in the office or at home by email. The doctor uses the survey score to recommend the EndFlame test and the starting dose of the 2 anti-inflammatory supplements. The patient conducts the fingerstick blood test at home, sends it to the lab, and begins the supplements, and when their results come back, the provider adjusts the dosage to meet the patient's own personalized therapeutic need. The patient stays on the 2 supplements up to 120 days, which is the time it takes for red blood cells to turn over, and then gets retested. Now, if their test results are in range, they go on a monthly maintenance dose. To begin using the EndFlame program in your office or with patients staying at home, I recommend you take the survey and the blood test on yourself to see how it works. Now, the cost of the lab fee will be waived if you haven't already received a free test. I'll email you the EndFlame survey to fill out and score. On your consult, we'll go over your score, and I'll show you how to recommend the blood test and the 2 anti-inflammatory supplements using a sample case study EndFlame report. Now, keep in mind that you shouldn't wait to begin offering EndFlame in your practice because most patients already need the EndFlame treatment protocol to deal with their muscle and joint inflammation. You'll get all that you need to start offering the program, the EndFlame symptom survey, and the EndFlame dosage chart. To get your free EndFlame blood test and schedule a courtesy 30-minute consultation with me, contact your Meyer DC rep at 800-472-4221. Now, if you don't know your Meyer DC rep, contact Matt Kraft, the National Account Manager for Supplements at Meyer, at extension 5040. Or you can contact me directly at 866-410-1818, extension 210, and I'll send you a link to my calendar where you can schedule on your own. This is Dr. Don Hayes, DC, saying, hey, thanks so much for watching. I look forward to talking with you personally. Bye for now.